lines, I think Beacon is a great place to work because we are the region's comprehensive stroke program. We have capacities to actually take away the clot if it's closing the arteries, and our interventional radiology team does a phenomenal job. Our ER and the neurologist have a very good mechanism of identifying stroke early so we can help these patients. On the back end, when these patients are discharged, one of my main objectives is always asking the patient, why did you have a stroke? And I would encourage you, if you are watching this video, to always ask the question, why did you have the stroke? Because if you don't or can't answer that question, that means we need to help you find that answer. Because if we don't know why you had a stroke, then it's very likely we will never be able to protect you from the next stroke. And in some cases, it's a simple thing like doing a monitor and making sure you don't have an abnormal rhythm such as atrial fibrillation, because you can take a pill or do a procedure and prevent yourself from having another stroke from that problem. In some cases, especially in young people, you can have a hole in the heart. And here, if you're young and that's the only thing you have, and there is a defect that people are born with, about 25% people have this hole in the heart, we can put this device, and this device is called PFO closure device. And we can put it across the heart septum where the hole is and close that heart so the clots don't travel from the dirty side of the heart to the clean side of the heart. And that's something that is preventable. Another thing that many times people will be found to have would be they have blood clotting disorders and they would need to take treatment for that. But it requires a comprehensive coordination between the neurologist, their primary care, and the cardiologist, something that we like to call heart-brain clinic. Now, these heart-brain clinics were officially only available at some of the premier institutes in America before, and now with the collaboration between Beacon cardiologists, Beacon neurology, and primary care doctors, we are actually able to provide the same care here. The patient will get their care for the stroke in the hospital, they get discharged, they see one of our neurologists in the office, and then on the back end, they will make sure if we have not found a cause, they will come to us and we'll see the patients and help them identify what caused the stroke. And sometimes it's a simple thing of taking an aspirin and a cholesterol pill, because those two things can prevent the next stroke from happening. And it's surprising when you look at the recent data, about 1/3 of the patients were still not taking these life-saving medications. So make sure you talk to your doctor and find out why you had the stroke and you are on the right medicines to prevent the next stroke.